Hello, everybody. How are we doing today? So, um, don't know how many people are in here yet. Doesn't look like there's anybody in here yet, but oh, hi, Des. How are you doing? Um, so I wanted to take a few minutes. Don't expect this to be a very long broadcast. Oh, two people. Okay. Um, but I wanted to talk about. Everybody keeps talking about the different variants of COVID. I'm doing pretty well. Um, let me start off. Let me start back off with a little bit of an introduction for anybody that catches this later doesn't know me. My name's Brian. I'm an ICU nurse. Um, I am. I've been working in an ICU for several years now. We have been. Um, yeah, there's actually quite a few more variants than just three. Um, but I've been working as an ICU nurse now for several years. Been on the front lines of COVID through the pandemic in a smaller hospital. Um, but we have seen our share of COVID deaths, unfortunately, more than I would like to count, honestly, and many more than I can remember to count. Honestly, it's been a very long road over the past year at this point. Um, But the main variants that people keep talking about and I see popping up are like the UK variant, which is B117, the South African variant, which is B1351 or 351. I'm located in Central Florida, Tampa area, roughly. Um, Then there's also the Brazil variant, which is called P1. And then there are also two California variants, which were identified back in February of this year, B1427 and B1429. Um, Hello, Tori. Thank you for popping in. Um, but the UK variant was first identified in the US back in December of last year, and it's now become the most common strain in the US. Um, and it is more contagious than the previous strains that were here. And it also comes with a higher risk of death. And there is some research showing that it is possibly spread more by children than other strains. So we have seen places like Michigan where that is the number one strain, and they've been seeing spikes in cases there. Um, so it's um, kind of disheartening that we've let this go as long as we have. The South African variant was identified here in the US in January of this year. The Brazil variant as well, January of this year, is first detected in Japan during a routine airport screening of travelers coming back from Brazil into Japan. And then the California variants were discovered in California in February of this past year. And those two are classified of variants of concern because they seem to have roughly a 20% increase in transmissibility, which means that they're much easier to transmit. Um, and that's not a good thing because a lot of places, California is looking at lifting all of their restrictions as of June 15th of this year. And the only thing they're basing that on that I've read so far is the fact that they've seen cases going down, and if they can continue to keep a steady supply of vaccines coming in, the governor there is that's stating that he will um, lift all of the restrictions in California by June 15th. So Um, and this is with two more contagious variants running around in California. Um, but they have seen a decrease in deaths recently, as a lot of states have. We've seen over the last 4 weeks, week over week, we've seen a decrease in the number of weekly deaths. About 4 weeks ago, we were at about 23,000. Then the following week, it was around 13,000, and I think we were around 8. And I think last week we only had, I want to say it was between 3 and 4,000 total deaths in the country, which is good. A lot of that can be attributed to the fact that we are seeing lower caseloads. Um, a lot of that can be attributed to the fact of multifactorial things as well, such as the fact that we are still using social distancing measures. People are still, in many places, still wearing masks. People are still um, practicing good hand hygiene. Um, at least I hope they are. So yeah, and that's one of the big things is it has really decreased because the virus, or because the vaccine. Because they have gotten out and gotten a lot of people vaccinated, but a lot of people, and I've seen this firsthand, unfortunately, a lot of people um, get a false sense of security once they get even the first dose of the vaccine. Recently had a patient die who died one day before his second dose of the vaccine was due, of severe complications from COVID. According to my research, what I've been looking up on vaccines, pretty much all of the states have enough vaccines. They're not pushing them out in certain states as quickly as they need to. Um, California, if I remember correctly, was fairly high on the list of percentage of vaccines that they had received versus how many they had actually given out. Whereas places like Georgia ranked almost at the bottom of the list. Florida ranked around the 41st, I think, on the list, and that's where I'm at. So some places are making it harder to get vaccines. Um, a lot of states now, I believe it's 16 states now, are allowing anybody ages 16 and up to get vaccines. And I believe that New York, trying to what New York and another state had just see if I can find my note from yesterday. New York and another state had just what was it? New York and Maryland are now allowing anybody 16 and over to get the vaccine, which that includes that's a total of 16 states are at that point now where they're allowing that many people to get the vaccine. Excuse me just a second. Sorry. Did not mean to cough in y'all's ear. You just got 16 and up in California too. That's good. Oh, thank you, Peter. I appreciate that. Where are you at, Des? Because I don't believe that Florida has hit the 16 and up mark yet. I'd have to go back and look what the total list of that was. But I mean, vaccine rollout has increased dramatically. I know we had like, what is it, 4.1 million administered doses over this last Saturday, which hit up a record. That's a lot of doses of the vaccine. That's a lot of people getting vaccinated just in one day across the country. If we were to keep numbers like that up for the next several weeks, we could have a majority of the population vaccinated. Um, so that's one of the nice things about kind of living in the age that we're in. We have the ability to look this information up almost instantaneously. As soon as it's reported, we can do a quick search online, find 5 different people who've written an article about something. Um, and one of the big things is people are still questioning, well, is the vaccine safe? Um, it has shown very minimal side effects in most people. Um, my take on the new variants, I believe, from everything I've read, the new variants, there's none that are um, listed as, and I want to term this correctly, variants of high consequence. There are ones that are variants of concern. The ones that are variants of concern right now are the 2 out of California. Um, and those are B1427 and B1429 because of their increase in transmissibility. Um, P1 is the one out of Brazil. I don't think it has such an increase in transmissibility as the California variants do. But the most prevalent variant right now in the United States is the B117 variant, which came out of the UK initially. The vaccines that we do have seem to be working against these variants just as well as the previous variants that they created the vaccines for, which are good. And that's why these new variants the California variants are classified as variants of concern and not necessarily variants of high consequence. To be listed as a variant of high consequence, and if you follow me on Twitter, I actually posted this CDC website and a variant of high consequence, and I'm going to read this directly from their website here. And this is in addition to possible attributes of a variant of concern. So there's attributes of the virus that they're looking at that say, okay, this is just one that we're going to look at. This is a one of concern. This is high consequence. And those that are possible attributes of high concern are ones that impact medical countermeasures. So they demonstrate failure of diagnostics, where now all of a sudden we're testing, but we're not coming up with positive rates because now the coronavirus is fooling the test, so to say. The other thing is evidence of significant reduction in vaccine effectiveness. We have not seen that yet with any of the variants that are out there. And what they're saying by that is a disproportionately high number of vaccine breakthrough cases. And what that means essentially is somebody that's gotten the vaccine gets the disease and ends up with a severe um, case of the disease. It doesn't necessarily mean that you're immune to it by having the vaccine. It just means that you have a much higher chance of just having a very mild case, even with the vaccine. Um, and the more severe clinical disease and increased hospitalizations. Those are things that they look at, a variant of high consequence. Luckily, none of the variants have fallen into that category yet for any of the variants, which to me is a good thing. So, sorry, let me catch up on the chat here. Well, thank you, Des. I used to broadcast on Periscope. I'm fairly new to Haps. This is only like my second broadcast that I've done on here. I don't know if you're familiar with Davcat. She also broadcasts on here about a multitude of different things. I have been with, I broadcast with her several times on Periscope back in the day, and I was with her the other night for the first time on Haps. And she kind of gave me some tips on Haps and different things and how to use some of the features on here, which is great. Yeah, DavCat is awesome. I love her. She's great. I've known her for quite a while. I'm actually a Patreon of hers as well. Yeah, at Davcat. So yeah, if you get a chance, try and find her out, or yeah, Davkat, just the way that Peter spelled it there. But yeah, so I'm not so concerned about the current variants that we have, other than the fact that there is an increase in transmissibility in the two California variants. And the current UK variant does seem to be more contagious and have a higher mortality rate than previous variants. Um, the only one I really didn't talk about too much was the South African variant. I don't think we've seen that one as much here in the U.S. I believe that we've had several cases of it, but nothing like the UK variant, where it's just kind of taken off in places like Michigan, where they're reporting that's the #1 strain that they're seeing right now. Um, the California variants are still kind of staying to California and the West Coast for the most part, as far as I know. But I mean, there's still people traveling back and forth across the country, so it's just a matter of time before they start popping up everywhere. All these different variants. Um, there is a new one in New York City. What's the name? Which one is that one I was looking at? I didn't really go over the ones that are variants of interest. Yeah, the New York November one, that's the B1526. Um, it it is one that they're calling a variant of interest, which is kind of listed below a variant of concern in like their hierarchy of um, how closely the CDC is concerned about these different variants. There was another one in December too in New York. That was the B1525. So there's a 526 and a 525 out of New York in December. There's also a P2 variant out of Brazil, which is also on that list of variant of interest. But the ones that are more concerning are the ones that are the variants of the concern, um, which is the UK variant, the P1 Brazilian variant, the South African variant, which actually shows about a roughly a 50% increased transmission rate. So it is more transmissible even than the two variants that are coming out of California. Yeah, they're not as they don't have as high, the two out of New York, the 526 and 525 don't have as increased transmissibility, which is a good thing. Hopefully, the ones that are becoming less transmissible are the ones that are going to die out quicker. Um, Moderna, um, both Moderna and Pfizer have shown to be effective against pretty much all the variants right now that I'm aware of. I haven't seen any data showing that there's any major breakthrough cases with having had the vaccine and being exposed to these variants. Now, that's not saying you can't get the disease. It's just that you will likely have a less severe case where you will not need to be hospitalized and be able to get over COVID on your own. Um, I've heard that there's talk of boosters, Des. I don't know specifically. I know the latest information from Fauci is saying that the current um, vaccines offer roughly, as far as they know, up to 6 months of protection. But one of the reasons they can only say that is because we really only have about 6 months of true data. We have the early studies of people that in the first and second rounds of trials back in the middle of last year, but that's not a large enough group of people to really follow. No, I did not get a chance to actually listen to Fauci yesterday. I did see um, some highlights of it on Twitter, and I read a couple articles about some of the stuff that he had said. Oh, thank you, Mnemonic. Yeah. Yep, I'm from Periscope, so I've landed here on Haps. So far, I seem to like Haps pretty good. It is fairly easy to use, much easier than I thought it would have been, just because of everything I heard it could do. So, um, but that's really about all I had to talk about. I just kind of wanted to touch on the variants, just give some information about like the fact that the vaccines are being shown to work against the variants up to this point. Now, that doesn't mean that a variant can't pop up that would become one that would not be protected against a vaccine. I mean, that's one of the bad things about viruses. They're continually um, mutating, uh, and that's just their basic survival sense. I mean, it's basic survival skills on the viral level. It's what they've done for eons at this point is mutate into another form to preserve their own life. That's kind of basically what a virus does. Um, well, thank you, Des. I appreciate that. My Twitter handle is at BCMerce. Same thing as it is here. Same thing is on Twitch, on well, it was on Periscope, and it is also on YouTube. I'll type it out for you. There we go. So yeah, that's me on Twitter, and I've been on Twitter for a while. Um, and I mainly started doing broadcasts just to kind of talk about COVID, to kind of um, be somebody that's on the front lines, seeing this, experiencing it, and giving people kind of firsthand information. And not everything that I don't know everything. I can tell you that right now. I'm not a doctor. I am not a um, oh, thank you very much, Des. I appreciate that. Thank you for the Golden Squirrel Award. But I'm not a doctor. I don't know everything. I am just an ICU nurse. I can only speak to the experiences that I have had. I do know places that were hit much harder. New York, when this whole thing first began, the Northwest was hit very hard when this thing first began. But I think that we have all, um, as healthcare providers, been impacted by this a great deal, unfortunately. It is something that I still get mad when I see people that are not wanting to put masks on, or fighting with a store clerk about putting a mask on, because the store clerk has nothing to do. The guy behind the counter at the register is not the person that is making the decisions that company says that you have to wear a mask coming in here. That the company is doing that for the safety of everybody in the store and the safety of their own employees. Um, oh, well, my screen just went black for a second. I don't know. Am I still here? I guess I am. There is a very political aspect to that as well. That's very true, Des. Um, what's it like caring for patients with COVID? Do you see many of them? I've seen quite a few of them, Peter. Um, I just, we had one recently that, and I said this in the beginning, I might have said this before you came in, that um, passed away a day before they were scheduled to get their second dose of the vaccine. Um, so, I mean, that was hard. And normally, and this is pretty much the same in every country across, or every hospital across the country, is the fact that um, we don't typically aware we don't typically allow visitors in the hospital, but the wife had already had COVID, had recovered from it months ago, several months ago, and she begged and begged and begged to be there, and he died holding her hand, and we did every possible step, every measure was taken to try and save this guy's life. He had received every medication that we could give to him. We had actually put this patient into another trial of another drug that one of our doctors is spearheading at our hospital. Um, I don't think he already had COVID, because he had been, um, he was, I think he had gotten Moderna, so it had been nearly 4 weeks before he came down with it. For it to linger that long in a very mild state is very would be very atypical. Just typically, once you get it, um, within about 8 days at most, you start experiencing some symptoms. And if you're one of those unlucky people that is going to come down with a bad case of it, you experience those symptoms very quickly. I've seen a lot of patients um, just feel like they are struggling to breathe at any given time. Um, and then there are some patients that they don't even feel like they can't breathe, but you look at them and you look at their um, the numbers coming back, their blood gases, arterial blood gases, their SpO2 levels. Somebody that is they're not quite right. They're like, I don't feel that great, but I'm not bad. And you look at them and you look up at the monitor, and all of a sudden their oxygen saturation is plummeted from 88 down to 62, and they're starting to look a little bit gray. Um, do we have a treatment that we have in the stockpile that Trump was treated for COVID? I don't know what you're specifically speaking to. If you're talking about like the monoclonal antibody treatment that he received, but I can tell you that Trump probably received probably every treatment that we have, including remdesivir, which is a 5-day course of medication that has been shown to be one of the most effective things that we have so far. Another medication that I know that we're testing is Avaptidil, which seems to lessen the duration significantly of COVID, and shows to be, if started soon enough, can actually keep people from ending up on a ventilator and things like that. Because a lot of what we're seeing, a lot of what I've seen personally is the patients that do end up on a ventilator are the ones that end up having the worst outcomes. And what I mean by that is a lot of them end up dying. Um, or they end up in states where, I mean, they're just long-term hospitalized patients, um, which hits a very hard uh, part of nursing where you speak to families and loved ones and things like that about what is quality versus quantity of life. We can keep somebody alive for a very long time with certain medications and certain treatments and things like that. But there, at some point, the body is going to give out. The body is going to say enough is enough. I can't take any more of this, and it's just going to try and stop. And we do everything we can to prevent that from happening. But sometimes, like I said, it's about that discussion with the family about quality over quantity. You can live for another 10 days, 100 days, 10 years. But what's the difference? What is living to you? What is living to your loved one um, versus just existing? And yeah, it is difficult. It's quite difficult. That's probably one of the hardest discussions um, to have with a patient's family. And even for a lot of nurses, it's a hard discussion for them to even bring up with um, with with family members because it's a very touchy subject. It's a very hard subject to broach. If someone has completely new blood transferred into them, could they survive? Um, I don't know exactly what you're speaking to. Like somebody just like somebody with COVID. Are you talking about, or somebody with, um, or just in general? Peter, there's a lot of different factors that come into that. I mean, as a nurse, I can't make that decision myself. That decision is really for the doctor. My job as a nurse is to inform the patient, inform the family that um, these are the options. This is the course, either way that you want to take. Do you want to pursue this 100%? Do you want to uh, make sure that your loved one is comfortable? And then that's something that we relay back to the doctor. Um, but we can tell a lot of times as the nurse, as the bedside nurse, and you're the one that's spending hours and hours there at the patient's side, you can look and see a lot of times that you just have this feeling sometimes. I mean, you can walk into a room and once you've been doing this long enough and you can have a feeling of this patient's not doing well. This isn't gonna They're not gonna make it through the night, or they're not gonna make it till I take my break, if I'm even able to take a break tonight. Um, but it's different for everybody because I've seen some patients. We had a fairly young patient at the very beginning of COVID, and this is back when nobody even knew what they were doing yet. We're throwing everything at patients at this point. Um, a very young patient in their 30s. We honestly, there were several nights and days where we didn't think this patient would make it through that shift. Um, he ended up making, I won't say a full recovery, because he has been back into the hospital a couple times with breathing issues that have stemmed from the COVID because he never had breathing issues before. He never had asthma. He wasn't a smoker. He did have some comorbidities, but nothing crazy. Um, but I mean, it's different for everybody. Um, some people are able to go through more than others. Some people's immune systems are able to just kind of um, rally sometimes, and sometimes they aren't. Oh, no problem, Peter. And this is kind of a format that I like. I like when people ask questions because I feel it's more engaging because uh, I try and get to all the questions. I try and get to them in a timely manner. Sometimes, if the chat's moving really fast and there's a bunch of people in here, I end up not being able to get to everybody. But I try and answer as much as I can. Somebody with COVID, as far as the blood transfer in Switzerland, that is not anything that I'm familiar with. The only thing that we're doing here in the States right now is we're still doing convalescent plasma, which is plasma donated from recovered COVID patients that have antibodies in their plasma to kind of spur on the antibody um, process in patients that are suffering from COVID in the hospital. I will keep that in mind, Peter. I appreciate that. Thank you. Um, Yeah, so far I'm liking Hamps a lot. The user interface is really good. I mean, this is kind of off topic, but Dav the other night when she'd invited me onto her broadcast, kind of after the fact, we kind of just sat there and talked for a few minutes after she ended the broadcast, and she gave me a couple of um, points and tips and stuff like that. So, um, can the vaccine affect mammogram results? That I do not know. That's something you'd probably have to ask your doctor or a doctor. Because I couldn't even tell you that. I've never seen any literature or anything mentioning that at all. So that's something, like I said, you just have to ask your doctor about. Oh, you saw that somewhere, Tori? Read that a lot of people with vaccine ended up getting false mammogram results. Oh, that's kind of that's interesting information. I'll actually have to look into that. I might have to do some research on that. On the same breast as the vaccine was in, same side. Okay, yeah, because if your nurse is administering your vaccine in your breast, they missed your arm. Just so you know. I knew it. I knew what Tori meant. I know Tori quite well. um, but other than that, I really don't have a lot else to talk about tonight. I just kind of prepared some information on the different variants because I know a lot of people are talking about the Brazil variant, the South African, the UK, and just to kind of bring light to the fact that there are more variants out there, just that some of them are not as um, they're not as they don't hit as many boxes as saying, okay, this one's worse now, this one's worse now. Some of them have actually kind of digressed, which is a good thing too. Um, Maybe a good idea to delay a mammogram. Well, I would not, honestly, Des, I would not delay any routine test that a doctor is uh, saying that you should get. Um, what's the name of the breathing exercise where you bend over and breathe fiercely? Starts with a P. You sent me the article, Tori. All right, thanks. I will definitely read that when I get off here. Starts with a P. I don't know. Pursed lip breathing. There's that where you act like you're blowing through a straw, where you breathe out hard, breathe out fiercely, um, and that's to help expand the lung tissue. Um, I'm not sure. I'm not exactly sure what what you're referring to. So you lie on your front and bend forward and start taking strong breaths. Uh, I don't know. Honestly, I can't think of it either. I can't think of what you're. I can picture what you're saying, but I can't think of a term for that. Um, Pranayama, what? Pranayama? I don't know what that is. All right. Well, I appreciate everybody coming in. I'm probably gonna go ahead and wrap it up here in the next minute or two. I want to say thank you for all of the contributors, all of the award things. I don't even know if there's what are those things called? Broadcast awards. Okay, yes. Des, thank you. Peter, thank you. I appreciate that. So I got a golden squirrel and appreciate and stay safe. I appreciate it. Thank you. That is very, very nice of you. Thank you, Des. Thank you, Peter. I appreciate those contributions. Oh, you like the new glasses? I like them too. I wanted something a little bit different. Something I was tired of black frames for the past 20 years. I will stay safe. I won't be up broadcasting. I'm going to try and broadcast most of my nights off if I can. I won't be broadcasting the next couple nights because I do work. But that's that. So. Cats running around over here. So, thank you, everybody. I am going to go ahead and head out. I appreciate everybody coming in. Thank you all. Anybody that catches this replay, thank you for listening. I know I used to have a couple of replayers over on Periscope, so I'm guessing that if they're going to follow me over here, they'll probably do the same thing. I hope to see you all again sometime. Thank you, everybody. Again, Des, Tori, Peter, Buck. Thank you all. You all have a good evening. Stay safe. Wear a mask, socially distance, wash your hands, and just stay safe out there. All right. Everybody have a good night. Thank you.